My name is Joyce Adhiambo and I'm a sex worker living with HIV for 20 years now. I'm from Kenya and I work with Partners for Health and Development in Africa as a community champion for HIV, and I'm also a community researcher. I provide stigma and discrimination-free services because I saw the gap and the need to support my community because of what I've gone through as a person living with HIV. I found people who have been living with HIV not accessing treatment because of stigma and discrimination that they face in the community. So I was able to handhold my community members to ensure that they are there to treatment.
My name is Joyce Oluoch. I come from Kenya. I've been living with HIV for the past 22 years. I'm a representative of sex workers living with HIV, and I've realized that within the sex work community, we still face a lot of stigma from the community itself, our friends, family, and relatives who still feel that HIV is a contagious disease. And we also face stigma directed at sex workers living positively from the religious personnel who also feel that HIV is a condition that does not warrant anyone being near a person living with HIV. As a healthcare provider, someone needs to understand you better without you even telling them what your story is. I found this in Joyce Adhiambo, and that's why I thought she was the best placed person to be nominated for this award.
Joyce is one of the people who faced a lot of stigma and discrimination when she knew her HIV status. Joyce had lost hope in life. So through my personal story and actually sharing experiences with her, she was able to open up and tell me what she was going through.
Joyce Adhiambo was there for me when I really needed someone to talk to. I didn't even know her personally, but we clicked. She gave me a listening ear as a person and as a peer navigator. We talk to a lot of our peer navigators, but they will expose whatever you tell them. But Joyce Adhiambo is different. She has a heart of gold.
The impact of HIV stigma in the country is still high, and we need to do a lot to ensure that we reduce stigma and discrimination by bringing all healthcare providers and the community members together and to empower and sensitize them about stigma and discrimination.
If I may describe stigma both locally and internationally, I would say that stigma kills, and it lowers the self-esteem of sex workers. It demoralizes one's humanity.
What I would tell to a healthcare provider who is refusing to give a stigma and discrimination-free services is that they should uphold the ethics in the services that are giving to the community, and they should respect the community and give them what they deserve to be given.